Thank you for staying with us. This is Sunrise, and now we want to talk a bit of health. Recently, the Nigeria Center for Disease Control reported an outbreak of yellow fever in Bauchi. Now, according to the report, this is the first time that yellow fever has been reported in relation to that area since the outbreak started in Nigeria in September 2017. What may have caused this situation? What led to this outbreak? Well, we have the DG of the National Center for Disease Control, Dr. Chikwe Ihekazu, joining us from our Abuja studio. Good day, Dr. Ihekazu. How are you?
Hi, Nota. Great to be back on your show.
And welcome. It's good to have you here. But even though the circumstances for which we're dragging you in are not exactly that pleasant, but talk to us here. Yellow fever in Bauchi, Lassa fever in other parts of the country. For instance, Benue State, 25 or 22 people, Benue State. What's going on?
So, Nota, I think we're victims of our own success. You see, what has happened in Nigeria over the past 4 years is 3 to 4 years, is that really we've strengthened our surveillance activities across the country. You know, previously we weren't really looking. And the truth about infectious disease, the more we look, the more we find. So over many years in Nigeria, you would find people die of you know, mysterious illnesses or known causes, or, you know, what the newspapers call a brief illness, you know, and everybody that went to a hospital was diagnosed with malaria and typhoid, or, you know, some ridiculous diagnosis that made no sense to most people. So what we've started to do is really strengthen our surveillance activities across the country, and that has led to the finding of diseases that we thought didn't exist or were disappearing. And so really that's what has happened in Bauchi, what's happening across the country with the cases of monkeypox we're finding, Lassa fever in many parts of the country, is that at the beginning of any of these diseases, whether it's yellow fever or Lassa fever, they all present exactly the same way as malaria does. You know, they all start with a fever, it gets worse, you know, and, you know, many times if you don't make the correct diagnosis, you keep treating, or very often physicians say, you know, someone has a resistant malaria, which is all, you know, basically rubbish, because we have another, most of the time, there's another virus or bacteria causing that illness which hasn't been found. So what we've done now is really working with disease surveillance notification officers in the states, the new set of labs we've established across the country, state epidemiologists working in specific states, strengthened our surveillance activities, strengthened our laboratory diagnostic capacity, and through that we're finding more cases. So in Bauchi specifically, you know, Bauchi, we found 24 confirmed cases of yellow fever, all in Al-Kaleri local government area. So this diagnosis was made very quickly. We responded with the state government, you know, very successful response. And in the past 3 weeks, we haven't had a single confirmed case after, working with our colleagues at the National Primary Healthcare Development Agency. But, you know, one thing I'd like to say, just conclude on this segment, is on yellow fever specifically, for cases like monkeypox and Lassa, you know, we can understand why we have it. Yellow fever, no Nigerian should have yellow fever, because there's a vaccine, a very effective vaccine available in every primary healthcare center for free for every child born in Nigeria. And a single shot of that vaccine prevents the illness for life.
I'll have to interrupt you there. We'll come back and look at...
So we shouldn't be having yellow fever in Nigeria.
We will talk about why we shouldn't be having and what the people are doing. Are they buying into the idea of not having yellow fever? When we'll come back from this break. Welcome back. We're still talking about disease outbreak and providing solution. We have the Dr. Chikwe Ihekazu with us in our Abuja studio. Dr. Ihekazu, you were talking about the fact that we should not have any case of yellow fever in the country because there is a vaccine that takes care of it, as you said, for life. The question is, are the residents of the country, are they not aware of this vaccine?
Yeah, no, that's exactly what the main reason why I'm here today, really. You know, what we have to do to limit the spread and impact of infectious diseases can't be left to one federal government agency or two, can't even be left to the state government. You know, we have a collective responsibility around this as parents. All of us, many of us are parents, as school teachers, leaders of hospitals, private healthcare practitioners. All of us have to come together. We all have a role to play. So as parents, you know, no matter how difficult it is, at least take your kids to have those set of childhood immunizations that will prevent them from having polio, yellow fever, measles, all the vaccine-preventable diseases. There are many things we don't do well in Nigeria, and we accept responsibility for that. But one thing we've done fairly well on, and credit to my colleagues at the National Primary Healthcare Development Agency, is to make sure that almost every primary healthcare center in Nigeria has these vaccines available. The challenge really is getting our kids to these centers and immunizing them. Then secondly, you know, as leaders in our society, teachers in our schools, you know, doctors working in private healthcare facilities, whenever patients come to you or children come to school, it's a simple question to ask: have you received your vaccination? Have you been fully covered for the vaccine-preventable diseases? And that way, we can focus our efforts at the NCDC on those diseases for which there's no vaccine, that are more difficult, that requires a lot more collective effort, such as Lassa, monkeypox, looking to prevent the cases of Ebola should they happen in Nigeria. We really need to protect our resources to focus on those. And you know, whether it's yellow fever or even cholera, that is, you know, a really a disease of lack of provision of clean water. You know, those diseases should not be happening in Nigeria. So one thing we're really doing at NCDC is really educating, trying to inform and educate Nigerians to do their bit. And we are working very hard to do what we need to do, to provide the labs, to provide the surveillance infrastructure, to provide the disease messaging, but appealing to all Nigerians, play your part. Do what you need to do, and collectively, we can prevent these outbreaks from happening.
You know, there's this school of thought that believes that some of these outbreaks were deliberately introduced into the population in a bid to cut down the Nigerian population. Maybe that's why some people are scared of taking the vaccines, because they think they might go sterile.
So Nota, listen, I think Nigerians need to recognize that there's no single intervention in modern medicine that has saved more lives globally than vaccines. Now, this is across the world, from Christian-denominated countries to Islamic countries, to poor countries, to rich countries, north, south, east, and west. No other single intervention in modern medicine has saved more lives. So there's no reason why the same vaccines that have saved lives in Indonesia, in the US, in Saudi Arabia, you know, whatever country you can think of, should be targeting Nigerians for whatever reason. What makes us so special? So, you know, sometimes these rumors circulate. We do our best. We've worked with traditional leaders, religious leaders, to try and debunk them. But, you know, what makes us special? We have to think the same vaccines have saved so many lives across the world. So there's simply no reason to think that there's any reason why anyone would pay particular attention to Nigeria for whatever reason. So I will really encourage every Nigerian, take your child out to be vaccinated. All my children are. There's absolutely no reason not to. These are rumors that come from time to time, but there's absolutely no validity to any of them.
Okay, so as we begin to wind down now, let's look at how to educate the people more. So in Benue, you have cases of Lassa fever, about at least 21 suspected cases of Lassa. We see from the state about 8 cases were confirmed, while 5 infected persons have died. That's in Benue. Some other states have other issues, but your epidemiological summary for Nigeria from January till August the 31st talks about some of these cases. 2,254 suspected yellow fever cases reported in 535 local government areas, or all states, including the Federal Capital Territory, have reported at least 1 suspected case of yellow fever and all of that. That's your report from January till August. But let's look at how we can help Nigerians stay healthier. Benue, Lassa fever, what do we do besides the vaccines?
So thanks, Dot. I'm really happy you're referring to those reports. One thing we do at the NCDC is make sure every week we summarize what is going on. We haven't missed a single week in the last 2 years, and make sure journalists, Nigerians all over the world have access to these reports that are freely available on our website. So go look at them and make your own decisions. Our message to Nigerians, like I said earlier in your show, there's a lot that we can do ourselves. From simple hygiene in our homes to regularly washing our hands. If you're the principal of a secondary school or a primary school, please, in addition to focusing on the education and teaching, ensure that your children have bathroom facilities to wash their hands after using the restrooms. It's your responsibility as a principal to make sure that basic hygiene practices, our kids are educated how to wash their hands, why clean water is important. As a parent, take your child to be vaccinated. You might save his life, because if anyone as an adult went to Bauchi, if you're vaccinated, you can go to the hospital, you can touch the patients with yellow fever. You will not get infected if you're vaccinated. So really, our message is, at NCDC over the past 4 years, we've worked very hard to improve our capabilities to prevent, detect, and respond. But we can't do this alone. We need everyone to join hands to support the work you're doing. You know, it's Nigerians' lives that will be saved, your children. So do what you can do. The state governments need to come in and put a little bit more resources and support around preventing infectious diseases. And we will continue developing more labs, improving our capacity to do the detection, to work with our colleagues in MPHCDA to make sure that vaccines are available to every Nigerian. There's never been a better time for public health in Nigeria in terms of efforts at the federal government level to make sure that we are able to protect Nigerians from diseases that they should not be having in 2019.
Talking about efforts to prevent Nigerians from getting some of these diseases, the question of test laboratories, do we have enough of them yet? Because in your report, some samples were sent to Dakar, to the Reference Laboratory Institute Pasteur in Dakar. Is it possible to build some of those test centers and laboratories in country? Wouldn't that make it easier for you?
Yeah, so we actually have, so we have a new national reference lab in Abuja. You would see from that report that some were confirmed in Abuja and some were still sent to Dakar. So we're in the process now of getting accreditation to the lab that we have in Abuja. We've recently invited some journalists, some of your colleagues, to join us in visiting the National Reference Lab in Gadua in Abuja. They were surprised that such a facility actually existed in the country. They walked around and came out and were really in awe. So we have actually worked very hard to set up a state-of-the-art National Reference Lab in Abuja. There's a process of now getting accreditation from the World Health Organization to enable us to work fully and rely on the results from this lab. So we haven't gotten to that stage because it's not completely in our hands. But we're working very hard towards that. So at the moment, we still send some samples for quality assurance and retesting in Gadua, and that's why you see those results there. But in addition to the lab in Gadua, we're rehabilitating the lab in Lagos, and really our goal is to make sure that there's one reference lab with reference laboratory diagnostic capacities in each of the geopolitical zones. Once we've done this, we can't focus on all the diseases in all the labs, but we will specialize in specific areas. So in the south and southeast, maybe on monkeypox and Lassa. In the northwest and north central, more on meningitis and diseases that are prevalent in that part of the country. So we're working very hard to improve the diagnostic capacities. And for things like monkeypox, 3 years ago, we had 0 capacity in Nigeria. Now we can give you a result for any case of monkeypox in less than 8 hours. I can assure, and I had to do this recently, assure Mr. President that anybody that comes into the country suspected to have Ebola, maybe has landed in the country from a flight from any African country, we can rule in or rule out Ebola in less than 8 hours after we get that sample in the National Reference Lab in Abuja. So that's one area where we've grown a lot. We're not where we want to be yet, but we have definitely developed a lot from what we found 3 years ago.
Okay, what about how close a relationship does your center have with the universities, the teaching hospitals? Because we do know they do research in many of these university teaching hospitals, the University of Nigeria Teaching Hospital, Lagos University Teaching Hospital, and all of that. Are you working with the laboratories there, with the researchers there, for some of these things you're talking about?
Yeah, so no, that you've really hit the nail on the head. Apart from the labs in Lagos and Abuja, all our other labs are within teaching hospital settings. So you mentioned UNTH. UNTH has just joined the network of yellow fever and measles reference labs. So we would support them with reagents, with infrastructure. We would rehabilitate part of the lab. So we have just included University of Nigeria Teaching Hospital, Enugu, and University of Benin Teaching Hospital, expanded our yellow fever, measles, and rubella lab network from 4 to 6. So we now have covered, for that specific function, we've covered all the 6 geopolitical zones with the reference lab in Abuja. University of Ibadan supports us on antimicrobial resistance. It's actually, together with the National Reference Lab, we have 2 national reference labs for antimicrobial resistance, UI and the National Reference Lab in Abuja. So actually, apart from Lagos and Abuja, all our other zonal reference labs are within teaching hospital settings. We would then support them to carry out the diagnostics for public health relevant diseases, so that when a patient comes in with suspected measles or Lassa or yellow fever, they are not expected and will not be charged for the tests for those diseases, because they're of public health importance. Because you know, when someone has yellow fever, it's not just important to stop that disease in him. It's important to stop spread to others. So we don't want access to diagnosis to be inhibitor for the individual coming into the lab. So that's really our strategy. We're not building new labs. We're really working with labs in teaching hospital settings that exist already and supporting them to grow and become centers of excellence in their particular areas of work.
Okay, Dr. Ikwazu, your final word, if you had a word of advice for Nigerians in all strata of life, what would it be?
No, I think everyone should go home today and relook at their own kitchen and bathroom and water facilities. Make sure that they do the basics that they can do. I'd like every school principal and every teacher watching this show today to go back to their school and make sure, if they don't have running water, find a way of providing bucket water with whatever else you have so that children can wash their hands. Let us imbibe the culture of washing our hands, taking our children to be vaccinated, just, you know, the general hygiene measures. While we work, we continue to work to make sure that when there's a really bad infectious disease, that we can detect and respond, but that everyone else is working together as a collective to stop the spread of infectious diseases in Nigeria.
Okay, now, I say the final word that you have for the people, that has to do with your center and what you're doing in terms of research and diagnosis and all of that. When we come back from this break, you're going to tell us what Nigerians should be doing for themselves in terms of eating, exercise, and all of that. We'll look at that when we come back from this break. Welcome back. Our closing moments with Dr. Ikwazu. Now, Dr. Ikwazu, when we went on that break, some of my colleagues whispered some things in my ear, and I'm forced to ask this question. Some of them are not sure whether they've been vaccinated. Is it okay to get vaccinated a second time? And some are wondering how long it will take. I've told them that it will be a lifetime if the yellow fever vaccinated. So is it wrong, or would it be harmful to the system to be vaccinated twice?
So thank you very much. There's absolutely no harm in getting a vaccine more than once. So please let your colleagues and, in fact, everyone else working on watching this show, if you're uncertain about your vaccination status, please go get another shot. There's absolutely no harm possible for having 2-3 shots of the same vaccine. So better to be safe than sorry. Okay. I want to use my final words to really say, you know, a lot of the infectious diseases that we're talking about, some of them are transmitted by vectors. This could be either rats for monkeypox or Lassa, or mosquitoes for yellow fever and malaria. So there's a lot that we can do to stop these vectors from coming close to us in our home. So let's do the best we can to, if you are going home after this show or from wherever you are, and you see a refuse dump full of waste on your street, a few meters away from your home, just remember that refuse dump is the perfect attraction for rodents. And once the rodents are in your area, there's absolutely no way of stopping them from spreading into your home. So don't ignore the refuse dump at the beginning of your street and think it's someone else's problem. Please work as communities with your local governments, but just with your neighborhood to see what you can do about the things that you can do something about. If you get home, you see your children not sleeping under a mosquito bed net, please, do what you can do. Make sure they sleep under a net. You're preventing malaria, you're preventing yellow fever. Do the bits you can do. So really, I think the message I'd like to get out after this show, there's so much we can do together collectively around vaccines, around sanitation, hygiene, refuse dumps, bed nets, all those bits that we can do ourselves. Please, let's go home, do our very best ourselves.
You didn't say anything about healthy eating.
Absolutely. Why healthy eating is important and all the other things, the body too has the ability to fight off a lot of these infections. And that's really what prevents many of us from succumbing to them. Now, how do we keep our bodies strong? We keep them strong from doing what we need to do ourselves, from exercise to healthy food to just keeping fit. That way, at least, we're giving ourselves a fighting chance. But it doesn't, the message today shouldn't be if you're healthy, you don't need to be vaccinated or you don't need to boil your water. These are things you do in addition to all the others. So diet is important, exercise is important, all the other things that we need to do to help ourselves, as well as the preventive measures I've spoken about earlier.
Thank you very much, Dr. Chikwe Ihekweazu, who's the helmsman at the National Center for Disease Control. Thank you so much for sharing today with us, and we do hope our viewers heard that you can be as healthy as you can be, but also ensure your environment is healthy too. Thank you very much. And that is our show today. I want to thank you for letting us be a part of your morning. Thank you for sending in your comments. Professor Inmonohai sent in another comment. He says, let's go back to the drawing board and seek proper roadmap to deflood Nigeria. We must gradually replan our urban and suburban areas, and people must adequately be enlightened to understand the consequences of building houses without authorization from the government. On that note, I say, have yourself a beautiful rest of the day. I'm Neota Igbe.